hug, Jack. Oh, good boy. Oh, fucking hell. Yeah, okay, sit. Welcome back, everybody. This is a further episode 3 of updates on Stephen's prostate cancer. Da da da. Yeah, I know it's boring, Jack. First of all, I think I had a look back at the last update video I did, which was all about positive mental attitude, and I have to ask, who the hell was I trying to fool? My apologies to all of you if you watched that. Do you know what? The words are right, but I wasn't really there. And I think, you know, this little video, I hope I can perhaps help you understand why I was struggling so much. That sort of 10 days ago or so when I made that video. So here we are. This is Wednesday, 20th of February. Exactly 4 weeks ago today at this time I was on the operating table. The timeline since then was that 2 weeks ago I had the catheter removed, and on Friday of last week, the 15th of February, I sat down with my surgeon and went through all the pathology. So we're going to talk about a bit of those things. Let's start off, let's do it in terms of timeline. So if you understand how the surgery is done, to remove the prostate, they have to cut the urethra from underneath the bladder, and when it's all put back together again, they reconnect the urethra to the bladder and stitch it into place. Because of the way the surgery is done, what they do is they insert a catheter through the urethra, and then they rebuild the urethra over the top of the catheter, so it stays in place like a splint to hold everything in the right place while the stitches heal. I guess it probably could have stayed in until the stitches were gone, which would mean I'd still be using a catheter now, but they take it out 2 weeks, and I have to be honest and say I was a broken man for the Friday, the Saturday, the Sunday, and even into the Monday. I was seriously struggling and wondering whether or not I would ever be able to stand up, breathe, walk, talk, cough, laugh, or anything without basically pissing myself. I found that really, really hard. But that was then, and we are now basically 2 weeks on from there, 2 weeks on from having the catheter removed, and I have to say it's okay. It's not perfect yet. I have what they call stress incontinence. Getting up from a seated position is something that is a problem. Coughing and things like that can cause me to leak a little, but we are only talking about leaking a little. In general, the water works, continence is working as you would hope it would work, in that the bladder fills, I feel the need to go to the loo, I go to the loo, I can pee and I can stop it, and all that kind of stuff. And it has to be said that the stitches that hold everything together at the moment, they're dissolvable stitches, and it takes around 6 weeks for all those stitches to be gone. There are stitches inside the urethra, so they're actually in the way and stopping the valves from closing and things like that. So at the moment, I'm a bit expecting full continence at this stage is unrealistic. It will be another 2 to 4 weeks before we'll get a good idea of just how good it's going to be. The expectation is that by 12 weeks, it will be just normal. No leakage, no nothing. So let's hope that goes in the right direction. I'd say, although, as I say, when I made that last video, I was lying to myself and the world, we're now in a position where it's getting better, and I'm happy with it. The next thing I did was last Friday the 15th. We sat down, myself and my wife sat down with the surgeon. I don't think I've introduced the surgeon yet. Professor Christopher Eden. He operates with the NHS at Guildford Hospital, and he also has private practice which he operates from London Bridge Hospital, Guy's Cancer Care Centre in London. So I sat down with Professor Eden and we went through the results of the pathology from my surgery, and in general it was all very, very positive. Clear surgical margins around all of the removed tumour within the prostate. And you have to remember my tumour was it's class T3B as Gleason's 4+3 eventually. It had broken out of the encapsulation of the prostate, the seminal vesicles were involved in the tumour, and it turns out that of 16 lymph nodes removed during the surgery, 2, which were the 2 most closely associated, one on either side of the prostate, were also involved in the tumour. That's not good news, there's no hiding that. The debulking the tumour, knowing that you've got clear surgical margins all the way around it, is good news. That means that the prostate cancer isn't there anymore, but the fact that the lymph nodes were involved means that there's a chance that cells have been drawn into the lymphatic system, might be in the bloodstream, might be currently depositing themselves on some other part of my body, and I may have another cancer growing, which will still be a prostate cancer, but it might be in a different part of my body. We won't know until I can do a PSA test, which I'm told there's no point in doing it until we get to about 10 weeks after the surgery, so that's another 6 weeks from now. So we're just going to carry on getting better, and we'll do the PSA test, and we'll probably have a little conversation about that when it's done. But in all other respects, the surgery has been a success. It went entirely to plan. Nothing unusual about it, nothing unexpected, and physically I'm mending. I'm feeling better every day, without a doubt. I'm not as fatigued as I was. I still have a certain amount of pain. This is one thing I did discuss with Eden. Abdominal pain, which is from the surgery itself. I still have some tenderness where the instruments were inserted and bashed around or whatever. That's getting better every day. I'm probably only taking a couple of ibuprofen a day at the moment. So that as a guide, if you want to know how much pain there is, it's not really very much at all. It's just discomfort. It's feeling uncomfortable, and taking ibuprofen, it's a anti-inflammatory more than a painkiller actually, and that's what it's doing. It's just helping reduce the inflammation and helping my body heal. The place I have got quite significant discomfort is in the perineum. It's because that's where the damaged urethra is sitting, and when I sit down, as I am at the moment, it feels like I'm sitting on something pointy underneath me that's pushing up into my underside. It's really, really quite uncomfortable. It's getting better every day. Apparently about 1 in 5 people have this as a result of the surgery. In all cases, it gets better and it goes away. It's all to do with the fact that you've been bashed around in surgery. So don't worry about it. Take your time, get better. You'll get over it. So the last bit, and I completely recognise the fact that this video is being watched by family and friends and people like that, people who care about me, people who just want to know how I'm doing. And that's cool. You'll also be a few people out there who are watching this because they're going through the same thing, or they will be. They know that they're going to have to go and have the surgery, for example. And although we all have to remind ourselves that everyone's experience is different, if I can share with you my experience, then maybe you can gain some confidence that you're going to be all right. So, the The last thing, which of course every man is interested in, is erectile function. It really doesn't seem to matter how old or how young you are. It is something that matters, and you've got to deal with it. You've got to be able to talk about it. You've got to be able to hopefully fix it. So, here's some stuff about erectile function. If you have a radical prostatectomy on the NHS at the moment, and the tumour has broken out of the encapsulation of the prostate, as mine had, then they will not do nerve sparing. It's not in their brief to do it. It doesn't matter how much technology you throw at them, how much you plead with them, they're not going to do it. They're going to cut the nerve bundles that surround the prostate, and by doing so, you'll never have a natural erection again. Now, I went to see Christopher Eden. He did an operation using frozen section biopsies, and that allowed him during the surgery to establish the fact that the nerves were not involved in the tumour, and so he was able to do his surgery dissecting the nerves from the prostate and so on, and leaving them in place. Now that means that I have almost intact nerves feeding all of the penile area and erections and so on, which is great news. However, it's not going to be a bloody miracle. Those nerves have been seriously knocked about in this surgery. They are going to take quite a long time to recover. We're talking minimum 6 months, maybe up to 3 years before those nerves have recovered from the shock of the surgery. And in the meantime, that doesn't mean you're not, the nerve bundles are there, which means that you can have an erection. It just means that it's not going to be like it used to be yet. So what can you do? Well, it turns out that, here's part of the learning. If we can share this with you, it turns out that the most important thing is not to have an erection per se, but to make sure that there is good blood flow. Usually, your penis, cock, whatever you want to call it, when flaccid, has little or no blood circulation. It's minimal. Your body doesn't invest anything in circulating blood around it. When you're asleep, what they call nocturnal erections, when you have rapid eye movement, when you're in rapid eye REM sleep, you'll get an erection. Just about any healthy man should get a good half a dozen every night during REM sleep. And for a long time they wondered why. It turns out that what your body's actually doing is pumping fresh oxygenated blood in to exercise you. So even if you're not exercising during the day, your body's doing it for you at night. And one of the things that suffers when the nerves are damaged is the blood circulation into your cock. So they give you Viagra or one of those other drugs, because those are designed to dilate your blood vessels and encourage blood flow. So at some point in the next week or so, I have a prescription to collect, and I've been told I have to 2 to 3 times a week take a Viagra and encourage an erection. So this is what we're going to be doing. We might have to do it in terms of what they call penile rehabilitation. We may have to do it for more than a year. All kind of feels a bit weird at the moment as we're about to go into this stage of recovery. But this is what we're told. If you do it religiously, then it'll all get better and it'll all work normally. So that's where we're going next. What else can I tell you? I'm going to put a link in the notes below this video because a lot of this information about the rehab part actually comes from the Australian Prostate Cancer group, and they have a series of really good like TED Talk style videos on YouTube, and I'll put a link to their channel and maybe one or two of the specific videos I think might be worth tuning into. They're not short, like most of this stuff. You know, if you're actually going to bother getting into it, you're going to have to invest some time in watching it. But if you're about to go through this surgery, then it might be worth your while watching these videos, because there's a lot more information in there, and from the horse's mouth, not secondhand from me, and I'm not going to pretend I'm any kind of expert. So I'll put those links in there. I'll remind you as well, please, hang on, Jack, oh, you hop down there, just wait a minute. Woof, woof. No, don't need to do that. I'll remind you, please, there you go, here's my cycling top. I still can't get back on my bike yet. We're talking at least another 2 or 3 weeks before I can get onto a fixed exercise bike, and at least another 6 weeks after that before I can get out on the road and get practicing. But at the end of June, which is not very far away, I am riding the Grand Depart, the first stage of the Tour de France 2019, which is in Belgium, 120 miles or so. I will be riding it, and I'll be riding it with your help and support, because I want you to like, share, tell your friends, and ultimately put your hand in your pocket and sponsor me, because it helps with my recovery. I'll help you with yours if you'll help me with mine. Help me with my recovery. Help me with having some plan and ambition for the next few months, which gives me a target, something to aim for in terms of my rehabilitation after this. And that's it. I think the next time I'll be putting together one of these videos, unless something happens over the next few weeks, I don't know, I'll tell you, probably in about 2 weeks' time. All my stitches should have dissolved by then. We'll be seeing some changes in my continence. I should be taking the Viagra by then. I might give you a little update on that, see if anything's come up, if you know what I mean. Yeah. In the meantime, as I said on the last video, positive mental attitude. I think I really do feel positive this time. Last time, sorry, I was just trying to fool myself, even if I didn't manage to fool you. No, I think that's it. Do you want to add anything, Jack? No. Thanks. Tune in next week. We'll see you then.